Hi, my name is Joe Bartholomew, and I'm with the Indiana University School of Social Work as an adjunct professor and doctoral student. I'm also a licensed clinical social worker and licensed clinical addiction counselor. So our third component of SBIRT, which follows screening and brief intervention, is referral to treatment. And that's an important component of SBIRT. And why I'm here to talk to you is because of being a social worker, I can attest to the importance of that component of SBIRT. Because once you gather all this information, what are you going to do with it? Well, to give you a little bit of a background, social workers compose approximately of 70% of licensed behavioral health providers in the United States. So if you have the ability, try to refer that person to a social worker, because we are very good about knowing how to connect people to the appropriate services that they need. And we know the nuances and how to get people in. But many times you don't have that luxury. You don't have access to a social worker, or perhaps they are so busy with so many other things, they don't have the time to get to that person as quickly as they would like to. But if you can, do so. But there are some other things that you can do to help get that person connected to treatment services. And that's, again, where the referral to treatment comes into play. We have a study and other studies that show that many times for practitioners who develop a working relationship with social workers, that can go a long way as far as getting them into the treatment services that they need for any results that we have from the SBIRT process. Now, I'm going to provide you some resources here. Again, if you don't have that luxury of having a social worker available to you, there are things that you can access to gather information for referral to treatment. And with the internet, that has never been more easier than what it is now. So here in the central Indiana and beyond the state of Indiana, there are a few different ways that you can access treatment or find out where you can refer a person for treatment services. So if you go to n.gov and the InConnect site, you can see I've put a couple slides here that you can put information in to gather specific information, because it's not always where we want them to go for treatment services. The patients that we serve, we have to get information for them, because many times issues of transportation, insurance issues, and other areas of their life depend on where they need to go for services. So we need to do a little research, and if we get more in tune with what is available, then this process of referral to treatment becomes easier over time. So this is just one site that you can go to through the state of Indiana to gather more information, to be able to know where I'm going to put this person or where I'm going to refer them to. Another slide that you can see this is through the Substance Abuse and Mental Health Services Administration, through their treatment locator. And the more specific information that you provide, it can get to a more narrowed focus exactly where they would like to receive services from. And these links or these websites are also where you can go to find that information. Now, the interesting thing about this one that I have right here through the Substance Abuse and Mental Health Services Administration is also the same one that Dr. Carlson spoke to you about in the SBIRT app. So it is the location of the SBIRT or the SAMHSA link to be able to go in and find those treatment locations. And again, an important component of this is to make sure that we're consulting with the patients that we're serving and find out where they want to go, because there's no point of referring them to a place that they aren't interested in or is going to be a challenge potentially transportation-wise or being able to access that facility. To provide you a little bit more information as far as the research and the in-depth research that's going on about SBIRT, I wanted to provide you information about the interdisciplinary support that SBIRT has as far as implementation and practice. Now, there are all different types of SBIRT programs, and Dr. Vanderson, Dr. Carlson, and I have been involved with a couple of different programs here in central Indiana. So it can be, there are a lot of different variables when it comes into implementing SBIRT services in places. So there are a lot of variables as far as the venue, the location, the health system, and we know that it doesn't have to be heavy in that in regards to, depending on where you serve, it can be done in private settings and it can be out in the community and such. but we know that we have a lot of expert support from all these various disciplines, ranging from medicine, nursing, and social work, all the way through psychology, pharmacy, and dentistry. So these different disciplines have had exposure and training on the expert processes. And that's important because many times what a person might be willing to share in one setting with a certain discipline, they may be more apt to share in a different discipline as far as a setting for treatment. So that's why we hit all these different types of healthcare settings and systems, and that's an important component. To provide you some information, again, we have different expert programs for different things. There have been expert programs that have been implemented in university and college settings where we focused on screening undergraduate and graduate students at university settings. We've also focused on training programs in medical residency programs where not just internal medicine, but family medicine, pediatrics, OBGYN, and other residencies have been incorporated into residency training programs. And many times those residency programs have transitioned into larger medical profession expert programs where we have brought in other disciplines to train alongside residents, and those could be nursing programs and social work programs and other allied health professions. And finally, a big component were state implemented expert programs where we implemented the screening processes in outpatient settings and sometimes even in hospital settings and emergency department settings. So we've really had a lot of different areas when it comes to expert program implementation and education. To provide you a little information about the research part of expert, there is a robust amount of information when it comes to expert for alcohol use or alcohol use disorders, as well as tobacco use and tobacco use disorder. There isn't as much information when it comes to illicit substances like opioid use disorder, and it's a little inconsistent, but it is growing and it is gathering more steam, if you will, as far as we're getting more information about that. But there have been studies where we have been able to learn that there has been good brief intervention interaction through the screening process after we get the screening results, complete the brief intervention, and thus we've gotten great information to refer those individuals for any type of treatment that they and the practitioner agree that they should receive. So there is information about that. So on behalf of my colleagues, Dr. Julie Vanderson and Dr. Joan Carlson, I'm Joe Bartholomew, and we really appreciate you attending today and learning more about screening, brief intervention, and referral to treatment. And at this time, we will be happy to take any questions that you may have. Thanks so much.